Good afternoon, and thank you all for standing by. This is the conference coordinator. All lines will be placed on listen only until we're ready for the question and answer session at the end of today's conference call. This call is also being recorded. If you have any objections, please disconnect at this time. I would now like to introduce your speaker, Ms. Elizabeth Matfeld. You may begin, ma'am. Thank you.
Hello. Thank you very much for joining us today. I'd like to take a moment to welcome you to SAMHSA's webinar series, Methamphetamine, a webinar series dedicated to promoting public health partnerships and safety for critically affected populations. Today's topic is emerging trends in methamphetamine across the nation. We'll focus on the changing patterns in substance abuse behavior related to methamphetamine. As you heard, your phone is being muted for most of the presentation, and at the end of the presentation, if you have questions, you'll be able to pose those questions by dialing *1, and again, we'll give you those directions at the end of the presentation. However, we do have a feature for this webinar where you will be able to interact with the presenter during the webinar. If you look on your screen at the bottom right-hand side, you should see a chat feature. If you click on that chat feature, it allows you to select who you want to send the question to, and what you want to select is host and presenter. And you want to also, if you look right above that on your right-hand side of your screen, you will see a button where you can click to raise your hand. If you raise your hand, that gives myself, the moderator, as well as the host or the presenter a sense that you have a question. So if you raise your hand and then type the question into the chat feature, we will try and answer that during the presentation. If you need technical assistance at any time during the call, please press 0 to speak to the operator, or you can also put that in a chat message, but as well, only put that chat to the host. Okay. Opening today's webinar is Dr. Ed Kraft. He has been providing the leadership, the guidance, the patient mentoring, anything we've been able to get from him for the past 3 years in regard to our methamphetamine work. I welcome him today and ask you just to make a few opening comments.
Thank you, Beth. Certainly appreciate all of the folks on the call today for taking time out of your busy schedule to participate in the first of our webinar series. This webinar series is part of our follow-up technical assistance program to SAMHSA's National Methamphetamine Summit that took place in November of 2008. We have been working with our 20 state and territorial teams since that time and continue to work with them and look forward to this series of 5 webinars. Beth has told you the title of the first one for today. Our next webinar will be held on February 16th at 2 p.m., and it will be on women, one of the critical populations from the summit. Then on March 2nd, also a Tuesday at 2 p.m., there will be a webinar on LGBT and meth, critical issues for a critical population. Then on March 16th, there will be a webinar on data and meth, getting to who, what, where, and when as the foundation of policy. And then finally, we will wrap up the series on Monday, March 29th, with justice-involved persons in meth, addressing a full continuum of services. So we do hope that you will participate in all the webinars, and we again thank you for being here today. We look forward to your participation and especially your questions at the completion of Mr. Stevenson's presentation. So now I think we're ready to start.
Thank you, Dr. Kraft. I also want to reiterate that those calls will all be at 2 p.m. Eastern Time.
Right.
Now joining us today as our guest speaker is Philip Stevenson. Philip is the director of the Arizona Statistical Analysis Center, which serves as the research arm of the Arizona Criminal Justice Commission. He chairs the Arizona Substance Abuse Partnership's Epidemiology Work Group and is a member of the Arizona Juvenile Justice Commission's Disproportionate Minority Contact Subcommittee. He does a lot of work. Phil also serves as Vice Chair of the Global Justice Information Sharing Initiative, Privacy and Information Quality Working Group. The Global Justice Information Sharing Initiative is the federal advisory committee to the Attorney General of the United States on Justice Information Sharing and Integration Initiative. He is currently Vice President of the Justice Research and Statistics Association's Executive Committee, and in his work for ACJC, Phil teaches crime and delinquency prevention and community relations and the justice system in Arizona State University School of Criminology and Criminal Justice. I know that sounds like a whole bunch of work, and I can tell you that this man works constantly around the clock, and we really appreciate the fact that he took the time to focus on this topic for us and share his expertise with us. Welcome, Phil, and if you're ready, we will turn it over to you.
I am ready, and thank you very much, Beth, for that very kind introduction. It does sound like a lot of work, but I will admit that it sounds far more impressive than the reality. Those of us who serve on boards and commissions recognize that really what we do is we just go to meetings and eat some sandwiches and talk for a little while. But thank you again for that very kind introduction. It really is, well, good afternoon, everyone. It really is my pleasure to be able to talk with you all about how we can use data to track trends in substance use, distribution, and manufacturing, and what those trends might tell us about emerging substance abuse issues. Clearly, the focus for today is on meth, but I'm going to take a little bit of latitude and encourage us all to consider some of the ideas, the strategies that we have implemented here in Arizona as a more broader strategy to identify those emerging substance abuse trends. Again, I'm not trying to minimize the importance of addressing our unique methamphetamine problems in our states, in our communities, and in our counties. But I do think what I'm going to present to you today, which is really just a set of ideas that I hope will stimulate some very interesting interactive discussion. I hope that I can learn from you all as much as I might be able to help you with your efforts locally. But as I said, I think that this strategy, this developing of a comprehensive surveillance system can and does apply to identifying emerging issues in meth and how those issues challenge our jurisdictions and our communities, but also for all substances that threaten the health and safety of our citizens. But importantly, instead of just talking about Arizona's Substance Use and Abuse Data Program that is overseen by our Epidemiology Work Group and the member agencies, and rather than promoting it as a program that you all should emulate, again, my intention is simply to present and discuss with you all some strategies that we have implemented here in Arizona, some that we are still working on, some that we are still trying to figure out, that we hope will give our prevention framework a head start on addressing the substance abuse issues, again, that are currently affecting our communities, and as important, if not more important, those yet to come. Hopefully, I am operating the slide forwarding properly, and you've all moved on to the next slide. These really are the major themes for the discussion that I hope we are going to have this afternoon. These are familiar themes, I'm sure, to you all. The first one really is, how do we support a data-driven process to not only inform current policy and practice, but also to identify emerging issues? I'm going to take some time to just mention a couple of trends. As you see, I put them in quotation marks because I'm not presenting to you trends in adult methamphetamine use or youth methamphetamine use. More specifically and more accurately, I suppose, I'm going to share with you some changes in policies and practices that we've seen across the nation and in some of our neighboring countries and how those policies might affect your local meth problem. And these are all policies that I suspect that many, if not all of you, are very familiar with, and I'll get into more detail when we get to that point. The Filling in the Gaps discussion will focus on how to assess the comprehensiveness of your data, the data that your epidemiology work group is collecting and using to inform policy and practice at the state, county, and local level, and recognizing that there will always be gaps in our data that we need to address, and some strategies for how those gaps might be filled in your substance abuse data system. Of course, it is important for us to mention and to comment on the three special populations, LGBTQ, veterans, and criminal justice system involved individuals, and the unique challenges they present in obtaining meaningful data from those populations. And then finally, it's all well and good for Arizona's Epi Work Group to continue to work on expanding and enhancing our data program. And if you ever had the opportunity to sit in on one of our meetings, you know that a group of researchers love talking about data and how to obtain more data. But that really does little good if those data are not shared with our community coalitions, our local governments, policymakers, practitioners that are really doing the hard work in the streets in our communities to address their unique substance abuse issues. So those are the major themes of the webinar. I do hope that it will only take 30 to 40 minutes for me to kind of present these ideas for you and some observations that have come to us here in Arizona based on the years that we have been building this data program and our data and our substance abuse surveillance system, leaving hopefully plenty of time for an exchange of ideas and comments and discussions. You know, in support of a data-driven prevention and intervention process, these are the types of questions that we here in Arizona continuously ask ourselves when thinking about our substance abuse issues and the development of our comprehensive data-driven surveillance system. Simple questions, those questions that we all learned in grade school, the what, where, who, why, how questions. For example, what really is the problem? Is it meth? Is it alcohol? Is it marijuana? Is it prescription drugs? Clearly, these are all challenges, problems for our communities. But as a wise person said, to govern and to direct is to make decisions, to make tough choices. And currently in this climate, we don't have the resources, and certainly prevention programs are often targeted for reduction in resources. But that nevertheless, or in fact, that might enhance the value of getting good data, comprehensive data that can allow us to better target resources. And I'm going to talk a little bit more about that later. But the what question is obviously important. And just as an aside, I went ahead and put alcohol, marijuana, and prescription drugs. That was not a random selection. Those are the three drugs that are, three substances that our youth here in Arizona are abusing more frequently than any other drugs. That is not clearly to minimize the danger and the threat of the terrible drug that methamphetamine is, but I just thought I'd throw that in there as an example of some other substances that we are keeping our eyes on and reviewing changes of. The where the problem is, I think, is also critically important. You know, one of the challenges that we all probably face in this data dissemination, data collection and dissemination strategy is, do we have data that's relevant to our populations, to our jurisdictions, to our state? Does national data apply to Arizona or Connecticut or Illinois or Washington or Hawaii? Are the problems different in our rural areas, even within a state? Are the problems different in our rural areas than our urban areas? One of the before I relocated to Arizona, I held a similar position in the state of Illinois, and one of the things that we saw early on in Illinois' challenges around the meth problem was that initially it was primarily a rural problem, a problem not only in our rural communities, but we could even highlight the southeast portion of the state of Illinois, and by collecting good treatment data and seizure data and lab data over time, we were able to see the diffusion and the evolution of our meth problem from just those rural communities, but as it began to spread north and northwest throughout the state of Illinois. For those who, like me, are not good or not great with U.S. geography, I apologize for the imagery of how it moved through Illinois. But another question of critical importance is who is affected most by the problem, and I will show you a little bit of data from Arizona that will speak to that. Is it a problem that all individuals face and suffer from, or is it threatening all individuals, or is it maybe just threatening our youth or our adults? Certainly any meth use is a threat, but again, in the spirit of using data to better target and identify those critically affected populations and areas, I think these are important questions. And again, of course, we should be caring about those special populations that sometimes it's very difficult to get data from and on, but we'll also address that today a little bit later. So what we hope here in Arizona and what we plan for is having a data system that can answer all these questions and the combination of them, not just the what, but the what and what is the problem, where is that problem, and who is affected. So these, not just in isolation but in combination, are the questions that we're trying to answer as well. Of course, there are other questions that I did not include on this list, and the big one is, why is it a problem? And of course, for meth, it is a problem, and I'm going to editorialize a little from my own perspective. It's a poison, right? It has significant cost. It has significant consequences, not only for those who are participating in that behavior, but our systems, our criminal justice system, our social systems, our treatment systems, that are in some ways responsible for caring for those who have gone down that road of substance abuse. Just a couple examples of some trends. Again, I'm calling them trends, but they are in fact changes in policies and practice. These are probably policies and practices that many, if not all of you, are familiar with. For example, the limiting of access to the precursor chemicals in the United States. More and more states are enacting legislation to require photo ID to purchase over-the-counter medications that contain pseudoephedrine. Those substances, those cold medications, those allergy medications that we used to be able to just walk into a Walgreens, CVS, any of your local pharmacy chains, and just be able to buy off the counter. They are now, in more and more cases, being restricted through their access. More and more states are starting to discuss whether or not it's appropriate to have these medications that contain pseudoephedrine, again, those that were typically available over the counter, that now might require a prescription, again, limiting the access to the precursor chemicals that are critical for those who are manufacturing methamphetamine. They need these substances, and typically they would like them in large quantities. I think this has an impact, though, and I'll mention that in just a moment. I also threw in a trend or a new change in policy that occurred in Mexico recently that has placed a ban on the import and use of ephedrine and pseudoephedrine in 2009. And of course, there's other policy changes that we've seen, these meth lab registries that are coming up in states, as well as registries for those who are buying the precursor chemicals, those products that contain pseudoephedrine. If anybody recently has suffered from a cold or allergy and wanted these medications, you probably had to go to a pharmacist, ask for it, sign your name on a log, show a picture ID. These are important policies because I think they have impacts on the problem. For example, one of the things that I think we're seeing more and more across the nation, and I do believe that in part this is in response to the limiting access, is the rise in the small one-pot labs, those small labs that can be carried in a backpack or in the back seat of a car or the trunk of a car. But this is a really important question of what impact will changing patterns, policies, and strategies have on your jurisdiction's drug problem. And if we approach these policies in a thoughtful way and think about the implications, oftentimes the unintended consequences, if you will, or the unintended implications of these policy changes, we can start to better understand what might be coming down the road. And the connection I'm making is that as we limit these precursor chemicals where people cannot, or they make it more difficult to do the smurfing activity where they're going around to the pharmacies and buying large amounts of these medications, or in the past when there were less restrictions on these precursor chemicals, acquiring large amounts of these chemicals so they could purchase and produce large amounts of methamphetamine. We are seeing that scaled back, and I think the pushback from the substance abusers and manufacturers of meth will be an increase in the smaller labs. I feel safe making that. I think that is a plausible, as we said in graduate school, a plausible hypothesis. And I think it's something important for us to think about. Again, the impact of our policies and how they will affect the drug trends in our communities. Let me move on to kind of the filling in the gaps conversation. And these are really just some examples from our experience here in Arizona. And again, I am not suggesting that we know everything there is to know about how to do this, and this is why I kind of am hoping that this webinar will, in the end, become a dialogue, an exchange of ideas that not only we have here in Arizona, but you all have in your other states as well. One of the questions, we go back to the who, what, why questions, is who haven't you heard from in your data collection strategies? Are you getting good data from youth? Are you getting good data from adults? Are you able to obtain data from system-involved individuals? And are you able to get data from the public? Let me speak just briefly about each of those. For example, in Arizona, we have great school-based youth data. Every 2 years, we implement an Arizona Youth Survey that collects self-reported information from kids in 8th, 10th, and 12th grade. Our samples are large, 50 to 60,000 kids. We get outstanding data on those kids who are attending school, right? But the question then is, who are we missing? And I just gave it away by saying who we're missing are the kids that aren't attending school. And I think a reasonable argument can be made that those who aren't attending school are those who are more likely to get involved in the behaviors that we're trying to prevent. And that has implications for how you fill in those gaps. And I won't just leave you with that question. I'll also try to provide you with some answers, at least what we're trying to do here in Arizona to fill in that gap. For us, adult use of meth, particularly those who aren't involved in any of our systems, those who are not involved in our criminal justice system, those who are not involved in our treatment system. And I think, again, there's a reasonable argument that you could say that those not yet involved in our criminal justice or treatment systems, we don't know anything about their use in Arizona, and we're working on filling in those gaps. And I am curious, actually, to hear about how well you all in your experiences are doing that as well. And then, of course, the system-involved individuals, those who are involved in our criminal justice system and our treatment system. Generally, most states have very good treatment data. But again, you have to ask the question, who are those going to treatment and where are those data coming from? Here in Arizona, we have good data, as well as probably most states, on those who are participating in treatment in publicly funded facilities. But what about those folks that are going to privately funded facilities? Is that an important population that we need to hear from? Does that help us better understand our substance abuse challenges here in Arizona and our meth challenges here in Arizona? We believe it does. Clearly, there are some serious hurdles that need to be addressed to be able to get that information from private facilities, if at all. But again, it's worth asking the question, and it's the same form, put two different ways. Who are we hearing from, and what does that tell us about who we are not hearing from? The criminal justice system, as most of you probably know, one of the more effective data collection strategies for understanding substance use among criminal justice system involved folks was the old ADAM project, the Arrestee Drug Abuse Monitoring Program that has been discontinued. Here in Arizona, we're lucky that we have a jurisdiction that has supported our own local version, and I'll talk just briefly about that and show you some data from that program a little bit later. But are we getting it from not just arrestees, but what about probationers? What about those who are entering our Department of Corrections? Adults, juveniles, men, women. These are all critically important questions for you all to ask in terms of better understanding your data and better use of that data to inform policy and practice. And again, the general public for us in Arizona, the issue really is those who are not involved in the treatment systems. Continuing on the filling the gaps, it's not just about who, but it is also about what. What haven't we heard about? Are we asking the right substance abuse questions? Are we asking about the right types of drugs? For example, here in Arizona, our youth meth data collection went away for 4 years, and that caused us a little bit of consternation when we were trying to better understand the historical trends. Obviously, we've reinstituted those questions, but that is, again, are we asking the right questions? For a little while, we weren't in Arizona, but hopefully we've responded effectively and have included the meth questions back into our Arizona Youth Survey. But are there other substances that we should be concerned about? I know before I left Illinois, there was more conversations around salvia. Those conversations have come up here in Arizona as well. In Arizona, given our proximity to Mexico, there's more and more interest in something called soma, which is available in Mexico. And so we are continually challenged with, are we asking the right questions so we really fully understand? And again, my broadening this discussion to other substances is in no ways meant to be diminishing the importance of us focusing on meth, and I just want to reiterate that. In terms of individuals seeking treatment, I think I mentioned, we have pretty good data on those who are in publicly funded programs, but not those in private treatment facilities. Arrest data, I'm moving on. Arrest data doesn't always provide the specificity of drug types. If you have access to arrest information, oftentimes what you'll see in kind of your statutes, and as I think it's worth reviewing your criminal statutes as it relates to controlled substances, but many states, oftentimes the charge is possession of a controlled substance. Well, that really doesn't tell you a lot about what specific drugs are challenging our youth, our adults, our communities, and the citizens of our states. Important limitations, if you will. We've also seen, and I'm sure you all are familiar with this, where in certain settings, what data you will get is not, and if you will get data on meth, it's not just meth, it's amphetamine and meth. These are important definitional issues. Now, I think that there is good reason to believe that that currently, in this day and age, a lot of those positive tests or whatever that source of that data is really about meth, but it's always good to be, again, familiar with the data, the strengths and limitations. And, of course, the question is what to make of this information, and that's where I threw in, is a lab, and that goes back to my plausible hypothesis that what we might be seeing is a rise in one-pot labs throughout the country and in our jurisdictions. If you haven't already, based on the pushback from those who are manufacturing it, who can't get large quantities anymore. And so when you look at your lab seizure data, it will be important to consider, is a lab a lab? Is the individual who's making small amounts of small amounts of methamphetamine, is that the same? And does that have the same impact? And does that require the same response as the larger labs that certainly we saw in Illinois in the late 90s and early 21st century? And certainly here in Arizona, we were seeing a lot of large amounts being trafficked across the border from Mexico because of what previously was an unlimited importation of the precursor chemicals. Important to consider those contexts in my mind. Also critically important to identify where have you heard and from where you have not heard. Again, this goes back to the point that I made earlier. And it really is about, are you getting data on all your communities? There's a great deal of variation. You know, the two states that I've worked in this field, Illinois and Arizona, large geographic areas where folks in northern Illinois and the culture of northern Illinois is somewhat different from the culture of southern Illinois. Just like here in Arizona, the culture of northern Arizona and the demographics and the circumstances and context quite different in northern Arizona than what we see in southern Arizona. So it's critically important, I think, for us to get data on all our communities so we can better target prevention efforts, intervention efforts, and our other strategies to prevent methamphetamine use and abuse. And I will confess, for us, one of our challenges is getting good data from our tribal jurisdictions and from our tribal coalitions. Again, this speaks to the importance of identifying these geographic areas from which you don't have good representation on, but I'm also going to put a pitch in for your epidemiology work groups that this is also where the membership of your work groups are critical. Here in Arizona, we have the Intertribal Council of Arizona participating on our epidemiology work group, and so we are working with them to assist us in getting better data collection programs set up in our tribes so we can better understand the challenges that our tribal communities are facing here in Arizona. I do know that not all states, I think it's somewhere between 30 and 35 states, have federally recognized tribes, but for us, it is critically important given that we have 21 federally recognized tribes here, land-based federally recognized tribes here in Arizona. 2 points here in terms of that I want to make in terms of who are or are we not hearing from. One of my favorite recent quotes comes from President Obama's science advisor, and he says, numbers, and he said in a testimony to Congress, numbers are always something, but never everything. That particularly resonates with me as a statistician, as a sociologist, and a criminologist who loves dealing with large population samples and large data sets, that what I don't want to diminish is the value of the community's voice. Those individuals who are in those communities and telling us what they are seeing, even when we can't confirm it from our data. Those anecdotes are critically important for us, and in some ways they are, and I'll speak to this a little bit later, they are we use the term, there are canaries in our coal mine. Those are the ones who are on the front lines, if you will, who are seeing these things certainly before I do in my office in a government building in downtown Phoenix. And so even though those are anecdotes, even though those are individuals' perspectives, should not be discounted, cannot be discounted. And that's why this last bullet point on this slide, the community, critically important. Even as we build our data program, even as we collect data from all across the state and all different types of individuals, the individual voice of those people who are in a position to know is critically important. Let me move on to some data. I'm a statistician. I think I am biologically prevented from not putting data into a presentation based on my love of data. It's just whether or not people ask for it, they get a little bit of data. And this is just an example of how it's and why it's important to really understand the context in which your data is collected. And what this slide shows, and it's, I think I got the site right. This is data from the National Survey of Drug Use on Households and the Arizona Youth Survey from 2002 to 2008 on the age of initiation. And if you look at 2002, if you look at 2004, 2006, and 2008. And those are we do the Arizona Youth Survey on off years. That's why we only have that data. You see these really significant differences between the age of initiation in the U.S. From the NISDA data as well as Arizona. And the question that we always ask ourselves, again, is why? And it is the question that we ask about all the data. Why are we seeing this data? Why are we seeing this trend? And what does it tell us? What this tells us is, and I suspect that many of you have already formulated an answer in your own mind, why is it so different? It's because of who's being asked the question. It is not the case where in Arizona, or at least we don't think it's the case, where our age of initiation is so dramatically different from the rest of the country. But the green bars, I'm assuming they appear green on your slides as well, are just from the youth. These are 8th, 10th, and 12th graders, right? These are kids who are typically no older than 18, so we miss all those folks who may come to methamphetamine, may initiate their use of methamphetamine at a later date. The NISDA data does not limit, as you all know probably, to just 8th, 10th, and 12th graders, and so that's the reason for the difference. The question and the answer is this a real difference? No, it might not be a real difference because it certainly is affected by who is being asked the question. I think critically important to understand the data. Again, it's not just a matter of getting the data on meth use, abuse, manufacturing, distribution, but again, understanding what it tells you and what it does not tell you. Here's another example of how Arizona State University's AARON program, our local version of ADAM, can inform discussion and debate around our meth problem. And again, the rhetorical question that I pose to you all to think about is what does these data tell you about the meth problem in Arizona, and what are the implications for prevention, intervention, and treatment policy and practice? Clearly, here in Arizona, among arrestees, again, being specific to the population from which this data is collected, among arrestees, a far larger problem for our adult arrestees than it is for our juvenile arrestees. Again, this is not to diminish the costs and the consequences and the risks of youth using methamphetamine, but again, in these very difficult financial times, it is important for us, I believe, to be able to best target our resources where the problem is the greatest. But again, these are choices. These are the choices that your policymakers make. These are the choices that your practitioners have to make because they don't have unlimited resources and unlimited time. Just another example of how good data that begins to fill in the gaps can give us indications of where we should be targeting our resources and giving us, in some cases, some hints as to what comes next. What are those emerging trends, especially when we can collect this information over time. So let me give you, if I can, just some ideas of what we've tried to do to fill in some of the gaps in our data collection efforts, and hopefully we'll give you some ideas for your states and your jurisdictions so you can better assess your problem and better identify emerging trends in meth use. But again, I've expanded this to other substances that might be challenging your communities. These are just some of the additional data collection and information sharing strategies to complement our ongoing data collection activities. As I said, one of the gaps we've recognized that we have fairly good data on individuals involved in our systems, hospitals, treatment systems, and criminal justice, but we don't know, but we'll soon get an idea of what is the degree to which meth and other drugs are used by adults not involved in any of the systems. And we've dovetailed onto a public opinion survey that's being done and added some substance abuse questions due to the generosity of our Governor's Office for Children, Youth, and Families, as well as the administrators of the survey, St. Luke's Hospital here in Phoenix. As I pointed out in the last slide, we now have better data, and this is only a recent advantage for Arizona, on those jail-based surveys, those arrestees, both adult and juveniles, those adults who are being booked into our jail facilities and those juveniles who are being booked into their detention facilities. For those of you who aren't familiar with the ADAM strategy, it is a self-report survey, but it is also followed up with a urinalysis. So we get two sources of information. We get information on what these juveniles adults are telling us they are doing at the time of the crime and before the time of the crime, but then we're also able to conduct urinalysis that really gives us a clear idea of what drugs they were under the influence on when they get arrested. It is an advantage, again, and this goes back to always considering your membership of your epidemiology work group or whoever is taking responsibility for developing what I hope is a comprehensive data program in your states. But we've been lucky to have Arizona State University on our Epi work group for a couple of years now, and they are very generous with sharing their data. I mentioned it earlier briefly, and that is this concept of the canary surveys. We are working on implementing canary surveys and focus groups to really get at those, again, as I said, on the front lines of this problem. I absolutely recognize, and I remind folks that as a middle-aged white guy in a downtown Phoenix office, I don't have a good understanding of what's going on in our streets. I do work with community coalitions, and I do some volunteer, but your treatment professionals, those who are seeing those folks who are coming to them, we've tapped into school resource officers to try to better identify what they're seeing on our school campuses, and who they're seeing getting involved. Is it gang-involved youth, or is it broader than that? And then, of course, we think it's important to hear from the kids and those folks who are suffering from these problems. Those who are involved in this environment of substance use and abuse, we believe, can have some very important information for us. And we are working with both our Arizona Administrative Office of the Courts as well as our Department of Juvenile Corrections to gain access to those individuals who are on probation and incarcerated, and develop focus groups for which we can pull this information from them to try to help us better understand, again, what is the problems that are in our streets and in our communities. One other thing that we've tapped into is we have a company that does all the drug testing for probationers. And they have been brought into our epidemiology work group, and they are able to share data regarding drug testing results on probationers. Let me also point out that Quest Diagnostics also has data that they share on their web. Can be challenging to try to get it at the local level and get specific numbers, but they will give you an idea of those individuals who are going through workplace testing, the degree to which they're testing positive for meth or marijuana or cocaine or other drugs. There are ways to get at these populations, and we sometimes have to be creative, and I think this is where also this format, where a group of us get together and strategize and share ideas and challenge each other to come up with better ways of getting this information so we can better address our substance abuse problems. And then, of course, returning to the topic of our special populations, some very real challenges of better understanding and better serving the lesbian, gay, bisexual, transgender questioning population, the veterans, the criminal justice system involved. For example, should we target these populations for additional data collection strategies if they are not already in place? Or is there a way to begin to collect information from these populations, for example, through identifying variables and fields to existing data collection strategies? We've done a combination of both here in Arizona. Our Department of Health Services is working on adding a field to their behavioral health intake forms to identify sexual orientation. There's an example of adding a field to an existing data collection form that will help us get better information about these special populations. And I could, again, but I won't reiterate, the advantage that we have of having our own local ADAM, which we call ARIN, the Arizona Arrestee Reporting Information Network, that allows us to better understand the level and type of substance use among adult and juvenile arrestees through self-report and urinalysis. As I said at the beginning, it's all well and good. I love playing with large data sets. I can spend hours just cranking through data, running models, doing correlation matrices, all sorts of things. That's fun for me. Those of you who are laughing at me, that's fine. I get that. But that's not why we do this, right? Certainly isn't why I do it. We have to share these data. We have to disseminate these data to those who can really use these data to effectively implement policies and practices to address our substance abuse issues. And so here's just a few more ideas of how we try to disseminate our data. In some ways, or in some of these examples, there are things that we are already doing, and these are things that we are currently working on. For example, we really feel it's important to provide policymaker-friendly briefs. Typically, in my experience, if you really want to get the attention of the policymakers, they need to be brief. They need to be very clear. I like the idea of providing words, numbers, and pictures that all reinforce the same point. That addresses different learning styles. Those who are more visual will better interpret the pictures. Those who are more into the numbers will like tables, and some who are more literary, if you will, want to read about the conclusions. But the key is brief, to the point, broad enough that it addresses all different types of audiences at that policymaker, in that policymaker population. And clearly it's important for us to address what they care about. And I think it's safe to say that almost in every state legislature cares about money these days, right? We're also implementing a data dissemination strategy through the web, something that's very user-friendly, that's accessible to our communities, to our community coalitions.